The project to build a new infectious disease clinic at Fann Hospital is of great significance to Professor Moussa Seydi. For the past 6 years, he has been diligently seeking and raising funds to achieve this project. I must also mention that he initially secured a portion of these funds from an American foundation, which typically does not support infrastructure projects of this kind in sub-Saharan Africa. Professor Seydi was able to secure an exception due to his leadership and interpersonal skills. Also, in early March, when the COVID-19 pandemic struck, the head of state established a COVID fund to combat the pandemic. This fund fully financed the construction of this state-of-the-art tropical infectious disease clinic. I was very impressed by Professor Seydi's dedication to establishing these facilities, for which he fought very hard. That's why I'm delighted to inaugurate this facility at the end of December. The center, which will provide us with a modern facility that meets all current international standards for treating infectious diseases.
This is the dream of a man who wants to see improvement in his patient's daily life, to see research progress and more health projects to take off in Senegal. All this summarize the project for this new infectious and tropical disease department at Fann Hospital in Dakar, led by Professor Seydi. The initiative took shape when Senegal, like the rest of the world, was severely facing an unprecedented COVID-19 health crisis.
You know, Professor Seydi is a very committed man. He is very dedicated to what he does, and he is also persuasive. And anyone who listens to him talk about this project is first of all seduced and impressed by the quality of the infrastructure he wanted to put in place. Also, you want to be part of this great patriotic adventure because the project at the end to set up an infectious diseases clinic exists only in Senegal and nowhere else in Africa. This also explains why the head of state has mobilized billions and great financial resources to put it at his disposal to help him to fulfill his dream. That's why I can tell you also that this is one of the things in his life that he's most proud of. So that's why he's usually so full of thanks to the head of state. And that's why I'm pleased to see that national professionals are fighting with dedication and selflessness to secure funding to provide the best health standards for patients. We needed to establish a center capable of admitting all patients regardless of their social status. This center will enable us to take a significant step towards economic development in Senegal. All our infrastructures, whether in health or other sectors, must meet the highest standards. That's why including hospitals on this investment plan, we have ensure our health facilities are brought up to standards.
After the Gilead Foundation, the Senegalese government became the second institution to support the initiative.
First and foremost is a feeling of satisfaction and pride In all the policies I pursue, my goal is always for Senegal to be at the highest level in terms of standards. When I have established a Senegal Airlines, I aim for the state-of-the-art aircraft. The most recent train we built is also a latest generation model. That's why, in this case, I also encourage Professor Seydi to make this new clinic a health center of international repute. I'm pleased to see that national professionals, through their altruism, have been able to secure funding. They have fought to ensure that patients receive care in the best possible conditions, and building a health center that can hospitalize all kinds of patients regardless of their social status is essential, and this center will make that possible.
The global cost of the Infectious and Tropical Disease Department is around 4 billion francs CFA. 1 billion is donated by the Gilead Foundation. The remaining come from the support of the Senegalese government and the contribution of the Islamic Bank. This new building is a symbol of a gentle revolution, creating a wonderful synergy between cutting-edge technology and patient comfort, but also fosters an optimal research environment. For almost 20 years, Professor Moussa Seydi's silhouette has become very familiar to hundreds of patients who are being treated for different pathologies. We must say that if the medical doctor Professor Seydi is an emblematic figure in research for many researchers and young doctorates in Senegal, in Africa, and in the rest of the world, he looks even better walking down the aisle of the new Infectious and Tropical Disease Clinic with his team. The new department is in fact one of the best reference health centers in Africa and even in Europe. It is equipped with 72 fully equipped patient rooms, medical fluids rooms including 13 suites, 5 hospitalization rooms, and 5 rooms in a critical care unit with negative pressure. This last one, the intensive care unit, is well equipped with intelligent beds. It also has latest respiratory generation and the best ventilating technologies for COVID-19 patients and those requiring non-invasive or invasive ventilation. The department has 2 negative pressure rooms and a mobile X-ray unit as well. It is a consecration of cardinal values that the man wears for his team. We are very proud for this new infectious disease building, which is the reward of a job well done. Our team is indeed led by Professor Seydi, a boss who takes us under his wings. He is also an exemplary boss. He is like a big brother to the team. He shows us what we have to do to keep up a good job. Professor Seydi likes a job well done. He's punctual, rigorous, and respectful for the whole team. He's also a very dedicated person who loves his patient. The whole country can testify about that. He knows how to work with discipline and respect. The way Professor Seydi managed the COVID-19 health crisis in Senegal made us really understood the person. But he has always been like that, rigorous in his work, respectful of his patient and his colleague. We will therefore continue to follow his footsteps. We wish him really well with this project and wish that the entire team will be able to settle in the new building, be able to continue to carry out research, prevention, but also to continue improving healthcare in Senegal. Professor Seydi truly deserved this infrastructure for which he fought with hard work. The new Infectious and Tropical Disease Department is built with the highest standards and a secure environment. The new infrastructure is equipped with a video surveillance and a quad control system using codes and fingerprints. It has also 2 electrical generators that operate in redundancy as well as batteries in the event of a power cut. Equipment also includes organized oxygen plants, which provide 3 levels of security in accordance with international standards. In this service, people with reduced mobility as well as social cases have been taken into account at all levels. The Health and Social Ministry has expressed his satisfaction.
The first question I asked Professor Seydi was about the cost, and when he told me the amount, I replied, "You were able to accomplish all this with such modest budget? That is truly remarkable. This shows that in our country, we can achieve great things with limited resources. What matters most is the will to succeed and a commitment to productivity. When we look at what he has accomplished, we must acknowledge that it has been done for future generations who will be fortunate to be trained here with state-of-the-art equipment. The Ministry of Health should also benefit from this achievement, because this center will play a crucial role in responding to future epidemics, as it already has the necessary equipment. Our vision is to see how Professor Seydi can replicate this model in other parts of Senegal. Both of them passed their competitive examination for aggregation, with one achieving the top position and the other coming in second.
Dr. Moussa Seydi is an exceptional professor at the Faculty of Medicine, Pharmacy and Odontology at Cheikh Anta Diop University in Dakar. He is also the Chief Officer of the Infectious and Tropical Disease Department at Fann Hospital and the President of Senegalese Antibiotic Committee. Professor Moussa Seydi is an Associate Professor at the University of Washington and a member of the EAB External Advisory Committee for the Center of Innovation in Point of Technology for HIV/AIDS at Northwestern University in Chicago. Professor Moussa Seydi is a member of Senegal National Faculty of Science and Techniques. As a researcher, he is the principal investigator for more than 30 research projects in collaboration with several entities, among others, the University of Washington in Seattle, the DA International Database to Evaluate AIDS, the Northwestern University in Chicago, the Johns Hopkins Hospital in Baltimore, Maryland, the Burns University in Switzerland, and the Pasteur Institute in Dakar. Professor Moussa Seydi has received several awards, distinction, among others, in 2017, the highest award given in Senegal by the President. In 2021, he received 3 honorific awards. The first one, the highest honor by France. Second, the holder of the honorary in Denver, USA. And third, the Africa Impact Prize in Denver, Colorado, USA. Since 2024, in Senegal, he has received the most honorific title. We can also add to his title a promoter of ultra-modern infrastructure. Indeed, Professor Moussa Seydi always dreamed big.
In the long run, we aim to provide accommodation for the caregivers of our patients. At the Infectious Disease Department, we have a garden to create a more welcoming environment for our patients. It will be ideal to relocate that garden here along with other facilities, but the priority was to build this center. And we must keep moving forward, because if we do not progress, we risk falling behind.
On December 2021, The Tropical and Infectious Disease Department made a huge progress and is from now recording in Senegal medical history. To better appreciate this significant progress in modernizing patient care and accommodation, I invite you to take a look in the rear mirror.
We have identified several problems in our building. Waterproofing problem, plumbing problem, dysfunction of water supply, roof leakage problem, electricity problem with 5 initial fires this year, ventilation problem, building safety problem. During our on-site visit, you will see all problems mentioned previously. Let's move for the clinic tour. Here you have the dysplasia laboratory where PCR testing are done. Further, there is another lab for hematology and biochemistry testing on the right side. We got these laboratories with our collaboration with University of Washington that has been going on for more than 20 years, and we do have a dedicated team that is well trained and qualified. Not too long ago, there was a fire coming from the roof, and we had to evacuate everyone out of the place in emergency. Staff meeting is held here every Monday morning. This classroom is also used for medical students training, exams, video conferences, and PowerPoint presentations. The anti-Ebola vaccine trials are taking place here. There is a waiting room for the study. Offices for the child's physicians. And a room for the rest of the team, samplers, pharmacists, social workers. In this room are stored both vaccines and placebos for their studies. This is the way to go to the basement, which is not functional due to the infiltration of rainwater through the wall. It has not been used for many years. Here we have some offices, the pharmacy, and the toilets. These toilets have been damaged by waterproofing problems, as you can see it on the wall and the ceiling. The intensive care unit is just ahead. Look up the results of the leaks. Here is the computer room that is not functional. We have here the consultation room that does not meet the standards. We have had several cases of tuberculosis among the staff because these places are not properly ventilated. You see moisture on the walls due to the waterproof problem. In that case, as you can see, painting doesn't last. Outside the main building, we have a section named Pavilion Professor Salif Bajan. This pavilion was used as an Ebola virus disease center treatment. We have also a vegetable garden that helps us to feed poor patients. Our ambition is to integrate better infrastructure in order to maintain a safe working environment and improve the performance of our activities. We therefore ask your support for building a new edifice like this.
This calling that you just heard, made to the community of health donors, was a powerful breakthrough but not enough to convince. Then, the professor of medicine filed from his amphitheater and treatment rooms took his walking stick to preach the good word beyond our borders. During the COVID-19, he discovered a fighter, a passionate to his profession, who pleads the cause of the sick everywhere, mainly in the media. We must say that he has created a privileged platform for reaching the greatest number of people and opening the eyes of decision makers to issues involved in mastering medical research and patient comfort.
As you mentioned, the current situation shows us a rise of sick cases, even though we see that we have fewer cases than yesterday and the day before yesterday. This does not mean that the outbreak is not progressing. Instead, the number of hospitalized patients is on rise. This community outbreak is a bomb. It is a bomb. It can lead to any situation. We can wake up one day and see the number of cases multiplied by 10, 15, or 100. First studies said that one patient can contaminate 2 to 3 patients. Others said that it's between 7 and 8. But we do have a case where a patient contaminated 27 others. This community outbreak is extremely alarming. We are managing to hospitalize patients, and we do have patient beds available. But, as said previously, the number of cases can rise up to 1,000 in a day. And in that case, the question is if we can adapt and get 1,000 patient beds in 24 hours. I don't know the answer. That's why it is said that it's hard to say for sure the number of cases from which we will be saturated. We are trying to adapt. COVID-19 has enslaved us. Are we really free? No. To regain our normal life, our freedom, we need to take several actions. One of the best solutions remains vaccination. Because we cannot even compare the risk of disease with the risk of vaccination. Ask to Professor Seydi if the risk of contracting the disease outlasts the risk of getting vaccination. There is no possible comparison. With the example of thrombosis cases, we have identified 425,000 times more cases of thrombosis have been reported in patients suffering from COVID-19 than in those who received the vaccine. I would encourage more research in order to see what are the very best possible combinations. 3 days ago, we had a meeting at the Ministry of Health. Asked them to insist on the mobile strategy, because people who have difficulties moving around due to their unavailability or simply lack of financial resources need that we bring the vaccines to them, as we did it in the expanded program on immunization, where medical mobile teams went right into the villages to vaccinate people. That is how we were able to achieve good vaccination coverage. Indeed, vaccination strategies need to be tailored to the African context. Solidarity, yes. We also need to mobilize a lot of domestic resources and move forward. We can't always remain in a one-way solidarity mode. I also believe that in this international collaboration, we must insist on the fact that Africans must fight to find solutions to their own problems. International aid can be more effective in that way. For instance, as you said, India, which is in a catastrophic situation, cannot send its vaccines here. It is not possible. Let's not forget also that we have a maximum of 3% of the world's confirmed cases of COVID-19 and approximately a maximum of 3% of worldwide deaths due to COVID-19. We have a maximum of 3% of worldwide deaths due to COVID-19 in the current situation. Countries producing and manufacturing vaccines need them more than we do. We need to show solidarity, but we also need to make African countries aware of the need to do whatever they have to do in order to achieve quicker results.
The number of those vaccinated against COVID across Africa stands at a meager 8%, according to late 2021 data from the World Health Organization.
We need to communicate better. If we don't do that, we are going to lose doses. Like we lost 200,000, I think, doses already. I think that it is important not only to have the facilities to produce the vaccine, to be able to respect the cold chain, but we have also at the same time to communicate so the people can accept easily to get vaccinated.
Manufacturing is one thing, but Professor Moussa Seydi says distribution presents an entirely different challenge.
I think that the private sector has all ways to work with the public sector if we want to succeed in any kind of public problem health. All is not about money, about power, about position, but to be able to think about others and to see how you can help them is very important. Not only complaining, waiting from the government to do something. You have by your own to try to do what you can do. That's what I tried about the clinic, and it's the President Macky Sall who himself called me and told me that I saw your job and now I can give you all you want to build the clinic like you wanted to build it.
In this time of pandemic, when it is difficult to gather a crowd of people, the Denver Botanical Garden welcomed a distinguished guest, Professor Moussa Seydi.
Dr. Moussa Seydi is from Senegal. he is not the president of the Republic of Senegal. And he told me he was able to do this work due to greatly the support of the President of the Republic, President Macky Sall.
He is not the head of state, but he had a great support from him, and as such, he is paying tribute to the head of state.
The President Macky Sall took several strong measures since the beginning, including the ban of mass gathering and the closure of the establishment open to the public, the compulsory wearing of the face mask, the closure of the land and air borders.
In front of Colorado State Governor, congressmen, diplomats, donors, and researchers, Professor Moussa Seydi highlighted solidarity in diversity.
I am calling you to unity. Unity in the plurality between rich and less rich, between all men.
This man believes in the African Leadership Group. He has come all the way from Senegal to enrich the melting pot and broaden his horizon.
If you look around you, you should have an idea what the African leadership community look like. It's members from, obviously, the African immigrant community, members from the white community, members from the Asian community, members from the black community.
Another unforgettable event during the visit to the USA was the key handover for the town of Aurora. This honor and recognition belong to Senegal, but just through my person. It is a fine recognition for an African scientist of a world famous, whose speech toward unity showed that in the country of permanent dream, the best is always yet to come.
3 years later, the prophecy is coming true. The model is taking shape with the dream of a brighter future for healthcare professionals. Indeed, the new infectious and tropical disease building breaks away from images usually associated with our healthcare facilities in Africa, in particular in Senegal. Getting healthcare treatment and fulfillment becomes no longer a slogan, but a reality for the new infectious and tropical disease treatment in Fann Hospital. We do have here all the intensive care unit equipment needed for infected patients, including an EKG machine for patients who cannot move around, a defibrillator for cardiac arrest patients, a chest X-ray machine that we can bring to patients who cannot move also in this intensive care unit. We do also have a vacuum, which is at the same time a respiratory equipped with an OptiFlow. Indeed, this is a very highly sophisticated device.
Professor Vivian showed us the equipment at our disposal, but we also have other latest generation quality equipment. We are also very proud of this intensive care unit and hope that all intensive care units in Senegal will be able to benefit from the same or even higher quality equipment. This intensive care unit is absolutely up to standard. Regarding electricity, we have several backups, so there is no risk of power shortage in this intensive care unit. For oxygen, we used to have 3 safety levels, but now we do have 4. We used to have 2 central oxygen units plus oxygen cylinders and bottles of oxygen. But now we've acquired 2 other more central oxygen units. Here we have a bedside table, an armchair, and the bed. All the beds ordered are stamped SMIT. This one is an electric bed, and we have the sick call system here, which is also inside the toilets. The patient can therefore call for help if needed. We also have a TV. We do have the same here. Let's go now to the first floor, where I will just show you the laboratory very quickly. Here is the well-equipped P3 level lab. We can do all kind of labs here except P4 level lab. This very interesting equipment manages the temperature, the humidity, the pressure, the ventilation, and the air conditioning system. And there is also an air renewal treatment system, so no germs can get out and endanger anyone outside. And this also protects the staff inside who don't need to wear masks. How are you feeling today? Just want to check our breathing. Here is the type of equipment available. We do even have a TV and will keep on acquiring new equipment step by step. Here we have 2 rooms, one for men and one for women.
If the project for the new Infectious and Tropical Disease Department was the conviction of Professor Moussa Seydi, the achievement remains a meeting point for many hopes, aspirations, and beliefs.
I couldn't have done it without the help of the Lord Almighty and donors such as Gilead and the head of state. Also some friends, among whom I would mention Colonel Amadou Tijan Sise of the Customs Department. He's been extraordinarily efficient and helpful. I can't detail everything he's done for me behind the scenes. I'd like to say special thanks to my staff who have loyally and faithfully supported me in all my activities. The first thing I noticed about Professor Seydi was his ambition to rebuild another department. He was offered a new service outside the hospital, an offer that he refused. He preferred a public service to a private one. He has been loyal ever since. This project took 6 years to be completed, and he's been running behind this service for 10 years now. Today he has received the help of the Almighty because of his loyalty, his transparency, his seriousness, and his rigor. He also has other exceptional qualities that we know. He's also very visionary and ambitious. Imagine the department in a hospital that probably answers to a health center. Someone told me during a discussion that the construction of this center somehow looks like the construction of a hospital. The idea is to treat the patients here instead of letting them go elsewhere, to stay in Senegal, where we have skills and everything that is needed. God has helped us to do things properly so that we Senegalese can take care of our patients in our own facilities. This jail is indeed meeting all the needs of the population. We thank God for giving us the opportunity to take part and to be at this level. And we are looking forward to seeing you at the inauguration. We would also like to thank the project owner, Professor Seydi, who believed in us and continues to believe in us, and who gave us the opportunity to express our views. We thank His Excellency, the Head of State, for providing the additional funding and for supporting the project so that it could be completed, because at the beginning, we were working on a smaller project, but thanks to His action, we have now been able to complete this major project. I would also like to thank all Batiluk's employees, partners, companies, and workers who have worked on this project, and I look forward to seeing you at the inauguration very soon. Our company with his workers are working their tears off to complete the project that was given to us. On schedule, we had a global health crisis, the 2019 pandemic, which changed all paradigms and showed us that we absolutely needed this kind of infrastructure in Senegal. And it should even have been existed before the COVID-19 pandemic. That was a determining factor why His Excellency, the Head of State, subsequently supported us. Also, it is a source of great pride to know that tomorrow's patients suffering from infectious and tropical diseases will be treated in a facility in which we participated. We also wanted to prove that Senegalese companies and expertise were capable of carrying out this kind of project and creating jobs, especially for young people. It is also a message that we are passing on to young people, saying that we have the right to have ambitions, to believe in ourselves, and with the help of God, you can do it. A few years ago, I believed in that dream, I was alone in it. One would ask how I could have left a big company like Buick to start a construction business in Senegal. Yes, I did it because I've always been convinced that the biggest Senegalese companies are capable, by the grace of God, of reaching that level. So this project has also enabled us to demonstrate our capabilities.
After finishing this masterpiece, major challenges lie ahead in terms of investment sustainability, human profitability, research funding for the Cairo Foundation, and maintenance of the building. The advent of the new Department of Infectious and Tropical Disease, SMIT, is good news in the Senegalese medical field. It shows a new era in which medical professionals are the key players in designing and constructing medical infrastructures. A way, certainly, of telling to political authorities that development also requires quality care in a quality environment. In the future, Professor Moussa Seydi will be counted among the new torchbearers in Senegal. May the flame never be extinguished.